Okay, hello everyone. Thanks for having me today. I just wanted to give a presentation today just to give you an idea of what I may discuss with patients who've had thrombosis in the past. I get a lot of patients from Dr. Piazza and Dr. Goldhaber over at the Brigham and Women's, and I just wanted to kind of review some of the main topics that I talk to them about on a layperson level, so that you can get an idea of just exactly what to do if you've had that problem in the past, or if you take care of patients that have had that. All right, so the beginning of my talk, I usually like to just give a general overall picture of how I teach nutrition to my patients. And in your booklet, there are a couple handouts that were provided. And one of them is the balanced plate handout, and it gives information about which foods fall into which categories. It has a picture similar to this, but it's just a little bit more in detail, so you can refer to that after today. The main idea of the balanced plate is to try to get some weight loss going with our patients who've had thrombosis. The studies that have been done on thrombosis in nutrition are not highly connected as far as benefits so far. The studies that have been done show a weak correlation with healthy nutrition in decreasing thrombosis, and we definitely need more studies to see exactly what's the best type of diet to help prevent it. So right now, the main topics that I try to talk to the patients about is trying to get some weight loss, because the majority of the patients that we see are overweight or obese. And then the other piece we try to make sure is covered is trying to give them an idea of healthy nutrition as far as heart health is concerned, and trying to give it an anti-inflammatory piece to it. So this balanced plate kind of gives a person the idea of exactly what should be on their plate and which proportions. The start of this is typically around the half a plate of low-calorie vegetables. And this is the piece that's missing for a lot of our patients. One, because they don't eat vegetables all that much, or number two, they used to eat vegetables, but now they're on warfarin and they feel like they can't eat green vegetables anymore. This is a list of the number of low-calorie vegetables that could fill in on half of that plate. There may even be more than this, but these are the main ones that are out there. Some of them have vitamin K and some of them don't. One of the big pieces that I try to get across to our patients is to make sure that they're getting in that large portion of vegetables in order to get some weight loss going. The reason why this works is because vegetables have at least 3 times or more less calories than anything else that you can put on the plate. So by having this be the majority of the meal, it's really hard to overeat on calories if the largest portion is coming from these low-calorie vegetables. Now, as far as vitamin K is concerned, I've had a number of people, as I said, who totally stopped vegetables or stopped all the vegetables that are on this list because they have vitamin K. I would say the nurses that take care of our patients at the Brigham have done an improvement over the years at trying to make sure that they understand that what we're trying to do, instead of avoiding vitamin K, is trying to make sure that vitamin K is consistent. It would be best if it was on a daily basis. So what we're trying to do is avoid the vegetables that are in the very high section, which is at the very top. The most common one there would be cooked spinach, just because it's too high in vitamin K. The general recommendation that we're giving our patients at the Brigham is to have either something from the high group or a large portion of foods from the medium group. I would say my patients who do the best at maintaining their INR in a good range typically try to choose a microgram level of vitamin K that they would feel comfortable at, that would allow them to have some of their favorite vegetables on a daily basis, and then try to substitute in different vegetables in order to reach that goal. This is not something that has to be exact, but we're just trying to give them a goal to try to shoot for. So as an example, let's say we have a patient who really likes cooked broccoli, and they wanted to have a cup of that on a regular basis. So that means that their goal might be to have about a little over 200 micrograms of vitamin K on a daily basis. If one day they were not going to have broccoli, we would encourage them to try to have another combination of vegetables that comes close to 200 from the medium group, or if something included in the high group like Brussels sprouts want to be included, they'd have to have less than a cup in order to reach that. So I would say in general, my patients who can do something close to that usually do pretty well with their INRs. The other thing to help simplify it a little bit for our patients is I try to just have them concentrate on vegetables and not any other foods that have vitamin K. I find that the patients who really follow this maintenance of the vitamin K vegetables on a daily basis seem to do really well on a week-to-week basis with their INRs. So in order to get this going, we have them do the vitamin K vegetables, and then that might make their INRs different that next time that they go have it checked. And I always tell them to make sure that they tell the people who are in the Coumadin clinic to make sure that they let them know that they went to see a nutritionist, they're possibly trying to lose weight, and what they need to do is let them know that they're having vitamin K vegetables on a regular basis now, so their INR might be a little bit off, and that the people there would have to then adjust their Coumadin levels to this new type of eating that they're following. And then once they have that increased dose of Coumadin with the increase of the vitamin K from the vegetables, they can then see that week after week they get that nice balance in their INR. And this gives them the chance now to have that large vegetable portion on a regular basis to help them lose weight in the future, which would then also help possibly with decreasing thrombosis. So this is some of the things that we use to kind of guide the patients with consistency. So avoid the very high, choose a vitamin K vegetable daily, decide on that daily microgram level. They may need to eat 2 servings of the mediums in order to reach 1 serving of the high. And then the big thing is to avoid those sudden changes in vitamin K. In other words, plan ahead. If you know you're going out to eat or going to a party or something like that, make sure that there's a plan ahead about where you're going to be getting your vitamin K that day. What we don't want is somebody to avoid vitamin K vegetables for several days and then have a huge pile of cooked spinach on the next day. That could really send the INRs out of range. The next piece on the balanced plate that I wanted to talk about was protein. Protein's beneficial in that it helps make people feel full and satisfied after a meal or a snack. And another thing it can really do is really help with making sure that the blood sugars in someone's body are staying in a nice range to provide good mood, brain function, energy levels, and really it also helps to decrease the appetite. So inside your booklet, there's a picture of this graph in which there are blood sugar charts, basically, and the idea of the blood sugar chart is when people eat protein on a regular basis, they're able to maintain a healthy blood sugar and keep it in that medium range. When they eat meals without protein, it oftentimes leads to earlier hunger, and the blood sugars seem to change a lot more and may drop down. That could lead to maybe fatigue, irritability, mood changes, and definitely hunger. So snacking can happen a lot more. So if we're trying to limit calories, this could be a problem, because if people are constantly hungry, they're going to be choosing a lot more food during the day, and then portion sizes may get out of hand. So I find that my patients who seem to do the best with losing weight and maintaining it off are the ones who have consistent intakes of protein. This is a list of different proteins. Obviously, some of these are healthier than others. We try to, recommend more the seafood choices or vegetarian sources of the protein sources here, and the leaner ones in general. But they all do the same benefit inside the body as far as the blood sugars are concerned. So this is just a slide showing which proteins would be a little bit leaner. So if you have someone who's going to be eating red meat, the best cuts to get would have the word round in it, like top of the round tips, things like that. If someone's buying ground beef, they want to get in the 90% range. If they're into pork, the best choice is pork tenderloin because it's the leanest. And trimming the meats from with the excess fat can also help before it goes into the cooker. And the last one is that you can cook poultry with the skin on and take it off before you eat it. That helps improve the taste, but it increases the grams of fat by a fraction. This is a list of the carbohydrates. I usually typically have people have these fit into that section of the plate where it says starch or carbohydrates. So these are all things going to be breaking up into sugar before heading into the bloodstream. Once again, there's some healthier choices here versus some that are on the unhealthier side. But the idea is that they're all going to be causing that blood sugar surge. So the portion sizes of these need to be controlled. And typically I find that the patients who do the best are the ones who include a little carbohydrate with their protein similar in size. So on that balanced plate, if someone's going to be eating some rice at the meal, they want to be eating a piece of protein like my grilled piece of chicken here, roughly the same size. This gives a person an idea, how much rice should I eat? And my general idea is, try to keep the rice the same size as your piece of chicken. Between these two, the one that's going to tell you that you're full and satisfied is not the rice, it's the chicken. So if you figure out the right amount of chicken, that really makes you feel good for hours after the meal because your blood sugars go up nice and slow and they carry in for a long period of time. That's all based on what the protein's able to do as far as making you feel full. Having extra rice would not lead to more fullness or satisfaction long after that meal. So if you keep these two the same, then what happens then is that your blood sugars stay under control because you're not eating more carbohydrates than what the protein can handle. Okay, so typically if these two things are the same, that blood sugar is going to be in a good range and you will have not overeaten. Now the third part of this is when you have these two on that side and then you double the vegetable, like this, where you have twice as many vegetables on the plate than the rice. That also helps keep the calories down and gives you all those nutrients that you need. So that's the general idea at lunches and dinners, is to try to get the vegetables up and then keep the carbohydrates at the same level as protein. Now an interesting thing here is those portion sizes I just showed you, the carbohydrate portion of that rice is about 20 grams or so of carbohydrates. The portion of chicken I showed you was 3 ounces. That's about 21 grams of protein. So when you start doing this idea on your plate, not only do they look balanced on the plate, but also the carbohydrate and the protein grams on the side of the food label would be similar also. So when you go to check food labels, if the carbs and protein are very close to each other, then you know you're going to have that same blood sugar action, same fullness factors, and then you also get all the benefits that go with that, including improved mood, including improved brain function, and decreased appetite. I also get questions like this while I'm at work. What if I don't eat any carbohydrates? Well, if that's the case, then this is what the plate would look like, in which we want the vegetables still to be twice as big as the carbohydrate. So all we're going to do is take the rice away and make sure that the vegetables are twice as big as the piece of chicken. That helps in controlling calories once again. It doesn't work as well with weight loss if you take that carbohydrate portion out and you just double the portion of the chicken to take in that space. We'd rather have vegetables take over that space. If you're concerned about having more vitamin K vegetables, then you can have that portion of the plate where you're eating extra be a non-vitamin K vegetable. Something like tomatoes or carrots would be common examples that people have on a regular basis, and they don't have vitamin K of significance. So this type of plate could be incorporated within a diet plan. It's much lower in calories, but it is harder to maintain going long term. So that's why I always like people to have that idea of, if I wanted to include a carbohydrate with this meal, how much should I have? Well, you can add it in and just make sure it's not bigger than the protein, and that will give you the confidence to know that you're not overeating at that meal. And then the other question I get is, I don't really like vegetables all that much. There's no way you're ever going to get me to eat half a plate of vegetables, so what do I do? Well, that would mean that we'd want to try to go to the compromise plate. This is the one I pull out when the patient starts saying that there's no way they're going to be able to eat that many. This is also the same plate that I would use with children if I'm counseling a child. And I did that for 10 years while working at the Boston Children's Hospital. So this is the plate that works great for children or adults who don't eat large vegetables. So the idea here is still to include a vegetable, but to just try to make sure that all three parts of the plate are roughly the same size. That could also lead to good weight loss too. Because once again, the carbohydrate is under control, which really helps keep the calories under control. And the vegetables are there to help control the calories also. And the last piece of the meal would be, of the day would be the breakfast plate. And typically what I try to do is get some type of protein at breakfast. A lot of American type of diets have carbs at breakfast, and it leads to high blood sugars. And when the sugars go really high, the problem with that is that they don't get burned off. So the body says, hey, we got all these extra sugars around, let's turn them into fat. So the body turns them into fat and stores them. So constantly spiking the sugars after meals that have high carbohydrates could lead to problems with controlling the weight. So it also leads to a lot earlier hunger, because after those sugars are turned into fat, then the bloodstream has now been emptied of sugar, which the body then calls for more food, which means the person's going to get hungry again real soon. So I try to get my patients to have a protein in the morning, and it could be any of the proteins from that handout that has all the listed strong proteins to really make that fullness factor happen. Protein actually sends chemical signals up to your brain to say, hey, this person is satisfied and full. They don't need to eat anymore. And then their second job is then to take the carbohydrate sugars and let them into the bloodstream real slow over many hours. So I'm finding that my patients who include protein in the morning can really keep their calories down in the morning, not eat a lot of food, and last all the way till lunch. This could be combinations such as an egg and toast, or like a Greek yogurt with fruit. Just a couple examples of some of the patients who do the best with this would be the Greek yogurt or the egg type breakfasts. And if someone wanted to have a snack during the day, we also encourage them to try to include some protein in the snack, once again to prevent those blood sugar spikes and to help carry the person in that healthy blood sugar range all the way until the next meal. What this could also lead to is less appetite at the next meal, so they're able to keep their portions down at the next meal and eat more reasonably. So these are some examples of some of the things our patients may do that have nice combinations of proteins and carbs. I don't encourage snacking unless the person really needs it. So if someone can go breakfast to lunch to dinner and they make it through the whole day and they feel great, I just tell them, if that's the case, don't snack. You're eating the right amount of calories and the right balance. It's really keeping your calories down. It'll give you your best chance in order to lose weight. Add that in with some of the exercise, like what Dr. Foreman just talked about, and you get that combination that'll really give some good weight loss. Another healthy piece to the diet would be including some heart-healthy oils or fats. These are some of the healthier ones called monounsaturated fats. The interesting thing about fats is that they also help control blood sugars. Whenever fat enters into the digestive tract, it actually signals the gut to slow down and digest the whole meal or snack more slowly, which then lets the sugars out into the bloodstream more slowly and keeps the blood sugars more normal for a longer period of time. So we encourage our patients to have healthy fats on a regular basis in small amounts. We don't want large amounts of healthy fats just because they have a lot of calories. So these are some of the ones that we would recommend for monounsaturated fats. These are also good at controlling cholesterol. And these are some more fats that help control cholesterol and keep the blood sugars in a good range. They really lead to real fullness after the meal, helping to prevent more snacking. The healthiest ones on this list would be the omega-3s, which come from fatty fish. And there's a few plant sources of omega-3s. Those are walnuts, flax seeds, and canola oil and vegetable oil. Those are precursors to the omega-3s. So you actually have to take those oils and actually turn them into omega-3s inside your body. And our bodies are not great at doing that. So actually fish oils are superior to the fats from plants if you're trying to get that anti-inflammatory piece of fish oils. These are some of the benefits of omega-3 fats, including the anti-clotting effect, which I just alluded to. Also, if you have high triglycerides, you might see a decrease when you take omega-3 fats on a regular basis. They can also improve immunity. They can make your skin more soft. They also can help with brain function. Mild depression has been shown in studies to be improved. And the anti-inflammatory or joint pain relief may also be another side benefit. These are the fattiest fish out there. And the most common ones would be salmon and tuna. But if you're worried about mercury in any of these, those would mainly be found in the tuna and the swordfish. So those would be ones you may want to limit to once a week or less. The last piece I wanted to talk about as far as the food label was concerned was the piece about checking in on the total carbohydrates and the fiber of the food label. So if you're ever looking at a food label and you're wondering how many grams of carbohydrates this has and what does that mean, a typical piece of bread is 15 grams and a teaspoon of sugar is 4. So if you're looking at the label and it says 45 grams of carbs and it's, let's say, a portion of pasta, then you know you're eating the equivalent of having about 3 slices of bread at that meal. Coca-Cola can would have about 40 grams of carbs, so that means a can of Coca-Cola would have about 10 teaspoons of sugar in each can. If a food has fiber in it, then you can subtract that number away from the carbohydrates and get even a better, lower carb number. We call that the net carbohydrate. And that is because fiber is a carbohydrate, so it's included on all food labels as part of the total carb number, but it never gets into your blood. It just comes out the other end after you eat it. So you can actually take your total carb number, subtract out the fiber, and then you're left with how many grams of sugar are going to be going into the bloodstream. If you keep the protein close to that, in other words, single digits, no less than 10, then you know you're going to be having a fairly balanced meal or snack, and it's going to be going into your bloodstream slowly. I don't have my patients check total fat. I don't have my patients check cholesterol or sugar. Sugar you don't need to check because you're already checking the total carbohydrates. And the last piece is trying to make sure that our patients eat enough phytonutrients. Phytonutrients are the nutrients in plant foods that give them color. They also give strong aroma. So something like broccoli, for instance, would have a load of phytonutrients in it, and the phytonutrients have been shown to be the parts of the food that can help prevent heart disease and cancers. If a food does not have dark color, let's say something like cauliflower, it could be beneficial still because it has that strong aroma, so it's still loaded with phytonutrients. So we try to get in at least 2 fruits a day and 3 vegetables or more per day on a typical day between lunches and dinners and breakfasts. And if we can get that 5 a day for good health, that has been shown to be beneficial as far as heart disease is concerned. Thank you very much.